segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. It is called The Gift of Life. Last year, more than 3,600 people in the U.S. received heart transplants. Providence Heart Institute recently started performing transplant at Providence St. Vincent Medical Center. Here to tell us more, we welcome doctors Gelow and Kevin Koomalsingh. Good morning, doctors. This is fascinating to me. And let me start with you, Dr. Gelow. You specialize in heart failure, correct? And how do you determine that a transplant is a possibility for a patient?
We begin considering heart transplant when our patients with heart failure are having progressive symptoms and difficulties despite all of the standard therapies, and when we think that they're unlikely to survive the next year with their own heart.
Because people can live a long time sometimes with a bad heart, but at some point it gets worse, right?
That's right. Hopefully we can manage heart failure. Our goal is actually to prevent people from ever being in the situation where they need to be considered for transplant.
All right, so once you decide that they need to be considered for a heart transplant, what happens next?
Once we get to that point, our patients go through a multidisciplinary evaluation. And during that process, they also learn in depth about heart transplant and the other advanced treatment options. If they're determined to be a candidate, if it's the right thing for them, then they go on a heart transplant waiting list.
Wow. Okay. Dr. Koomalsingh, so a patient gets the call that they're going to get a new heart, and then you're the one that's going to do the surgery. What is it like for you to get the call to say, okay, here we go?
Well, that's a very exhilarating feeling and process for that matter. When a donor becomes available, you try to allocate as many of the organs as possible. So not just the heart, but the liver, the lungs, the kidneys. And so what that translates into multiple recipients in multiple centers with multiple constraints. And it becomes this carefully orchestrated event in order to minimize how much time the organs are out of the body and try to help as many people as possible.
How long do you have to get the heart to your patient? And then how long is the surgery?
So we try to minimize the time out of the body to less than 6 hours for the heart. And an operation can be anywhere between 4 and 12 hours, depending on complexity.
And where do the donor hearts come from?
So because we're limited by how much time the organ can thrive outside the body, that sort of dictates how far we can travel. In general, we try to restrict our travel to the Northwest and West Coast.
I see, that makes sense. Dr. Gelow, you typically treat patients then after the transplant for months, right? And what do you hear from them about how things are going after the transplant?
I think the biggest thing our patients tell us is how much gratitude they have for the donor and for the donor's family, and just a feeling of hope for the future, being able to get back and resume their life.
But because the recovery can take a while, right? Like how long can it take?
That's right. The recovery is variable. It depends on the unique situation of the patients. Many of them are very sick before undergoing the transplant. But after a few months, or especially after the first year, that's the hardest. Our patients do get back to enjoying a great quality of life.
Dr. Koomalsingh, so how important is heart donation then, or organ donation, and what can viewers do?
Well, thank you for bringing that up. This is an extremely important topic. Each year, as you mentioned, there's only about 3,500 heart transplants in the United States. And as you can imagine, there are many more on the waiting list. And so by increasing the pool, we can certainly help many more patients. So I think it's imperative that people consider becoming organ donors, or for the very least, having their families or loved ones know their wishes with regards to organ donation. And for more information, people can look towards Donor Life Northwest or the DMV website.
So either the DMV or Donate Life America. Thank you both so much, doctors. Appreciate it. We want to tell folks, if you would like to find out more, you can contact, if you'd like to find out more about American Heart Month, head to Family Matters page at KATU.com. There you'll find the resources for how to help your heart by managing your stress and much more. All right, doctors, thank you so much.
You're welcome.
Thank you.
Thank you. And we'll be right back with more AM Northwest. Don't go away.